These are the top 5 most Google questions on shoulder pain. Number 1 is, why does my shoulder hurt when I lift my arm?
Your shoulder hurts when you lift your arm because you have a muscle imbalance somewhere. Your joint is not moving correctly. If you think of the shoulder as a clock, you can be getting tight in certain places. Majority of the time, if this is 12 o'clock, then this is 6 o'clock, this is 3 o'clock, and this is 9 o'clock, right? Somewhere along the clock, you're tight, and so when you lift it, it's not quite sitting in the right place.
Number 2, what causes shoulder pain at night?
If you're sleeping on your shoulder and it hurts, we're gonna go back to the fact that your shoulder is not sitting in that right spot, and so somewhere along that clock, you could be tight. And then what it does is it shoves this bone right here, the humerus. You never want it going to 12 o'clock. So when you sleep on your arm, you're tight in very specific places, and it's gonna pinch you, and it's gonna pinch your tendon area, and then it tends to radiate and tends to hurt. The key thing is fix it so you can sleep on whatever side that you want, so that when you go to sleep and you sleep on your arm, it doesn't hurt, but it's because something is wrong mechanically.
Number 3, could my shoulder pain be a rotator cuff injury?
Absolutely. After the age of 40, you're bound to have wear and tear problems to your rotator cuff. When you're under 30, we tend to have instability problems of the shoulder. Age is very much a determining factor when it comes to shoulder pain, so make sure that your doctor and your therapist is paying attention to that.
Number 4, when should I see a doctor for shoulder pain?
If it's consistent, like if you've tried a couple of things on your own and it hasn't helped, usually I say within 4 to 6 weeks, go somewhere. And then obviously, if you know you didn't have a fall or an injury and you just know that it just doesn't feel right, you can go to a therapist and they can help you figure it out. If you fell and you can't lift up your arm, like definitely go to a doctor.
Number 5, what are the most common causes of shoulder pain?
Majority of the time, it is that rotator cuff issue, but it's like asking, well, what came first, the chicken or the egg? So you can have an irritation, and because that tendon gets irritated, certain parts of your shoulder get tight and it starts pushing your humerus bone into a different position, and so it can continue to irritate it more and more. Sometimes is because your capsule gets really tight in certain positions because of something that happened, and it could have been a long time ago, and now it's like rubbing, and then you get that tendonitis because of it. Just know that if you start having shoulder pain that doesn't go away, fix it before you end up with a rotator cuff tear, because once you tear your rotator cuff tendon more than 50%, you need to have surgery. So fix it while it's easy versus having to go through surgery and then fixing that can take months. Those are the top 5 Google questions that we saw. If you have any questions about your shoulder pain, come to my free workshop. We are hosting a workshop at the clinic January 24th at 10 a.m. and I'll answer your specific questions as it pertains to shoulder pain.